I'm Edward Carr, the Economist Deputy Editor.
Hello, my name's Callum Williams. I'm Senior Economics Writer at The Economist, and I am joining Ed to answer your questions on this call.
About a month ago, we did a Q&A on Covid-19 and all its implications. Well, a lot's happened since then. We thought we'd come back and answer some more questions, so here we are. There have been reports of people who have apparently tested that they've been cured from the disease, who then do seem to get a new infection. But really, that's very hard to interpret. There could be reasons for that. One is that fat immunity might not last. Another is that the test that they had wasn't accurate. A third could be that they hadn't actually properly got rid of the disease and it's flared up again. This question about immunity is really important, obviously, because it affects what happens when people who think they've had the disease then go out, and if they can catch it again or spread it, it might have an important effect on their behaviour. But the thing about diseases is that the immune system shows a very, very wide range of responses. In some diseases like measles, you get immunity for a lifetime. In others, like the cold, for instance, or flu, you might get immunity for 6 months, a year. And it's really too soon to say where on that spectrum COVID-19 lies. We've only had it for 4 months, so it's just too soon, impossible to know whether this immunity lasts.
A lot of people have said, well, if the economy does badly, then public health will do badly, and there's a lot to that argument. The way to think about it, though, is to look at the historical evidence for this, and what that shows is when there have been past pandemics, the countries that tended to lock down, or cities that tended to lock down fastest and earliest, over the medium and long run tended to have much better economic outcomes in things like wages and employment and business growth and so on. So even if you just look at it from an economic perspective, there's a very strong argument in favour of lockdowns.
So the lockdowns do in themselves have costs. They have costs in mental health, there's costs in domestic violence. Some people don't get treated for diseases they might either get treated for. So there are costs. It's just that those costs in the long run are so much smaller than the costs of letting the disease run wild. Well, this is an important question because you can imagine that the moment a vaccine is demonstrated to be safe, the demand for it will be huge. You know, everybody on the planet will want this vaccine. And there are a number of worries about that. There's a distribution that is optimal in terms of the common good, and that is for health workers, for instance, to get the vaccine very early because they need to be protected when they come to care and look after people. Then you'd probably pick the vulnerable, which for this disease is the elderly and people who have pre-existing conditions. And you'd work your way through the population according to vulnerability and risk. But there's a chance that the country that happens to either invented the vaccine or to have the facilities that can manufacture it, or has the money to buy it, that those countries will start to corner the market. So there are moves now, particularly among the G20, encouraged by the WHO, to try and set up systems today, before a vaccine has been discovered and approved, to appeal to the better side of everybody's nature and agree through the veil of ignorance as to what's the best way of doing this. But that, I think, will be challenged, and sort of, self-interest, understandably, but self-interest will at least challenge that system.
The Swedish case is the kind of $1 million question that no one really knows the answer to. When you read or listen to interviews with the various epidemiologists who are in charge of that program, they will say that it remains too early to tell how successful or otherwise their strategy has been. It has already come with a very clear economic cost. as particularly as people in older age brackets have held back and haven't gone out and that kind of thing. In terms of the number of deaths, I mean, they're not doing as badly as you might have thought, certainly when you compare deaths per person with other countries.
The epidemiology I've seen suggests that Sweden's cases are going up reasonably fast, but you just have to see with time what happens, because supposing there's second and third waves, the sort of lockdowns that you've seen, for instance, in the United States, I think will be very hard to introduce repeatedly. I think in some ways, if Sweden keeps the cases down, it's much more sustainable to have a policy that's more voluntary. People will do it, and I think that was part of the thinking behind the British approach originally. But in Britain it didn't work. Britain had a lot of cases, it wasn't happening. The Swedes claimed to be naturally socially distant because of the temperament of the Swedes. That's what they say about themselves. So maybe it's easier there. But these things are experiments, and some people will get it right and some people will get it wrong. The epidemiology so far, and it's not complete, but so far, suggests, one, that children aren't in particular danger. They don't catch the disease any more readily than adults, possibly less actually. And if they do catch the disease, they don't die from it. So that means that you aren't actually putting children themselves in danger by going to school, but you aren't really putting their families in danger particularly either. These are very sparse studies so far, but in Iceland and the Netherlands, they suggest that children haven't passed on the disease to their families from school. Now that might be just because schools actually happen to close very early, so you haven't had much opportunity to. And as countries like Denmark and Germany now begin to open schools, you might see evidence of transmission within them, which would have to obviously change policy. It's a very interesting example of how to think about this, as you should, I think, in all of these social distancing measures, which is they come at a cost and they come with a benefit. It turns out the benefits of this perhaps aren't as large as people thought, but the costs are really very high indeed, particularly to the children themselves, who might miss out on many months of education, setting them back by, some research shows, up to a year. And also to their parents, who obviously can't work because they have to be at home minded kids.
In economic terms, it looks pretty worrying. What we see at the moment in the financial markets is that rich countries, in particular countries like the UK, the US, Germany, Australia, Japan, there's enormous demand for safe assets, and that safe assets in that context really means the government debt of those countries. So they're finding it actually sort of surprisingly easy to borrow vast sums in order to subsidise wages and give grants to businesses and all that kind of stuff. Now, this is a luxury that most emerging markets or poor countries have to either to a much lesser extent or not at all. And so in terms of being able to support their economy, they have much less room for manoeuvre. And bear in mind also that they have a much higher incidence of things like informal work. So people who are not sort of officially employed and therefore are not able to access, some of the welfare state privileges that people in the rich world would have.
Some poor countries, or some bits of poor countries, Kerala in India, for instance, and Vietnam, have done extremely well in stopping the spread of the disease. So, social distancing is not high tech. It's harder in crowded cities, and it's harder to wash your hands when you have to queue at one water stand for many buildings. But it is possible to have social distancing. For me, the real question, I think, is sort of what happens next. People do not have savings to fall back on. They need to work. And it may be that a vaccine or a cure is it's likely that it's many, many, many months away. So, the transmission of the disease in India has slowed. It's now doubling about once every 10 days. And they've extended the lockdown, and the lockdown remains popular there. But it can't last for months and months and months. The first thing is to get a real understanding of how Covid-19, or rather SARS-CoV-2, the virus that causes it, how that went from bats to people. We need to understand that because coronaviruses, it's one of this family of 7 viruses that appear in people, but 3, COVID-19, SARS and MERS, have appeared in people in the last 20 years, having not really caused people many problems at all before then. So something has happened to mean that these viruses have come back again and again. So that's the first thing, I think, is sort of better understanding of the virology. And that involves China being willing to open up and let people find out what's going on, and it's putting up a big resistance to that at the moment. Then clearly, the second thing we've seen is that the WHO was either unable to put its message across or didn't feel it had the power to be exactly as explicit as it wanted about what was happening in China, first of all, and then warning people. But the WHO is a creature of the governments that created it, including the United States, and it doesn't have enormous political power. So a second question is to ask, are governments prepared to give the WHO or something like it a bit more oomph and a bit more teeth? The third thing is preparedness. It's really interesting how the countries that have done best with COVID-19 are those that had already been through something like it with SARS. I'm thinking of Taiwan, Singapore, Hong Kong, and those countries learnt important lessons with SARS that they then were able to apply with COVID-19. I think that'll happen on its own, but each country needs to go through its response to think about what worked and what didn't so that they're properly prepared. And one of the questions that they'll need to answer, I think, is to what extent do they need to feel that they produce their own supplies of medical equipment and drugs? I think there'll be a big debate to be had on that. We like to think we bring you the best coverage of COVID-19 and all its implications for the economy, for politics, and for science. One of the ways we do that is we produce a weekly COVID-19 newsletter. And if you'd like to subscribe to that, please click on the link opposite. Thank you for watching.